Is telemedicine, are you seeing a big swing in telemedicine, like happening way more? I see it a lot more myself, like different ads or experiences around it. But what are you noticing in that world?
I think telemedicine is great.
Uh
I
huh.
believe in the product. I think it's something that I use. I love using it because it's
Mm-hmm.
so convenient.
Yep.
During COVID, that was the only way that you could see a doctor.
Yep.
But utilization's gone back down to almost pre-COVID levels. And
Ah.
before COVID, it was pretty low. And it's not just with us, it's for other health systems as well that I've talked to.
Mm.
And there are some things that you would rather just do in person. Having your doctor see you face to face, I think, is definitely part of the care that it's going to be really hard to get rid of that experience.
Yeah.
Is it going to change still and change some more? Absolutely. But is it going to be where the majority of our patients will be seen virtually? I don't think so. And I'm willing to bet on that. But I know that's a lot of attention's going towards telemedicine. And it's again, another example, if we really did our research, if we really asked the patients and kept the patient at the center, hey, if you want to go see your chiropractor or orthopedic surgeon, would you rather, instead of just asking them, see how they do it, and most of the time they want to go see the doctor in person and show them,
Mm.
like, hey, this is where it hurts, my back, or what have you. So,
That's good. Yeah, I think it's like almost like, yeah, like a yes and kind of thing. Like, yes, telemedicine will exist. It's and, to your point, I do not think that one-on-one connection, in person in real life is going to ever go away. I agree. I
yeah,
think that will always be an element. There will be some technology plays where telemedicine and telehealth can really support the next evolution of things. But I agree. There's some stuff I know for me, like I just want to go, I want you to look at this thing on my arm. I don't want you to, I
exactly.
want you to look at this weird, whatever. So
Yep.
that's I totally get it. I would love your thoughts on there was a Deloitte article. I don't know if you saw this. It was on the
Hmm.
global marketing trends. The authors, shout out to Andy Haas, Michelle McGuire Christian, and Ravuth Kuki. The article is titled "Supercharging Customer Service with AI." And it's got
Hmm.
this claim that this rising marketing trend in 2022 is to combine AI and human interactions to create this smoother workflow within the company and build a much more effective marketing strategy through
Yep.
data collection. Are you
Yep.
noticing this trend at Summit Health? If so, can you give us an example?
We definitely talk about it a lot, and we definitely have been noticing this trend. Just because it's the big trend of 2022, healthcare probably will pick up on it in 2032. But I would say that it is absolutely something that we talk about quite often. So that's where we would love to combine our patient experience from a issue resolution standpoint, right? If you have a question about your bill or if you have a question about a prescription, a lot of times AI could probably handle it through a chatbot or directions, what have you, or appointment rescheduling. But there are some things that a person absolutely needs to handle, and I don't think we're there yet where something as complicated as healthcare and health records, where an AI bot could probably answer those questions. So it's a combination of the two for sure. That is something that we're looking at now. How
Hmm.
do we combine AI plus the human experience? Again, trying to make it as seamless as possible. And that's what I loved about that article too. By the way, it's just putting the customer at the center, putting the human at the
Yep.
center of it all. And I know this is not just a healthcare issue of not doing that, but I really do think as an industry like ours, it's just imperative. Otherwise, we're just wasting money and,
Hmm.
and, and time.
What do you think is like in terms of just marketing trends? Like anything else you're noticing in healthcare or noticing in your world in terms of trends?
Well, so there was this trend called consumerism in healthcare, and my boss at Summit, he's one of the pioneers of consumerism, which
Okay.
is really thinking this crazy concept of thinking what consumers would want instead of what the company would want first. And
Mind blowing.
I know it's we're 2022 folks, and we will sometimes argue where the pendulum's probably swung a little too much, right? Similar to what you and I were just talking about these gadgets or telehealth, or like, oh man, consumers will never want to see us in person again, or never would want to talk to someone on the phone again. That's not true. It's consumerism is about putting the consumer in the center, right? Not just going and building things and using technology that we think are cool to come up with ideas that someone thought of and spending a lot of time and money trying to build it out. And so a lot of our research actually that we've done ourselves shows that a lot of the things that people want from a healthcare company we already know about, right? Like they want to get better. They don't want to have to wait. There's just basic things that we should probably focus on first that we already know that we do a terrible job with. I always come back to this idea of just making the experience right, and that's what I think consumerism is. It's making the experience as seamless as possible, but doing it in a way that puts your shoes in the consumer. Hey, in this situation, would I really want to talk to a chatbot? Or in this situation, would I really want to go through an online scheduling tool versus talking to someone on the phone? Because I'm calling for my mom who is sick, who doesn't, who can't really talk that well. I'd rather just talk to someone on the phone, right? And so why are we pushing people away from the phone so much? And when we should be making it easier to talk to someone on the phone. But everyone else who doesn't want to talk to someone on the phone, let's make that easier as well through different tools. But I think to kind of wrap that up in a little sentence, it's we're trying to make it a hassle-free experience, but we do a really good job creating hassle at the same time. And
I love it.
That's just how healthcare is today in our country, and it'd be pretty cool to be able to change all that.
Hey everyone, thanks for watching. Please subscribe to this channel for more great marketing interviews with today's top industry leaders. And thank you to our partners at Salesforce. Salesforce brings marketing and engagement together. Head over to salesforce.com/marketing.